Welcome back to our series on pregnancy loss, and we will be talking about maternal causes. They can be divided into genetic, uterine abnormalities, chronic health factors, acute maternal factors, exogenous factors, and independent risk factors. So on genetic, maternal age is directly related to aneuploidy, and usually it is seen in over 30% of people aged 40 years who are trying to conceive. And aneuploidy, we said, is the numerical abnormality of chromosomes. And we also have now couples who have a chromosomal anomaly called balanced translocation. They will experience recurrent miscarriages, 2 to 3% in that case. And this is now the situation where you have had a balanced translocation when you were born, but it did not give you an abnormality yourself, but it's able to get into the generations after you and now cause a genetic challenge that can cause pregnancy loss. Then we have structural anomalies of the reproductive tract of women, and this will affect about 15% of them. We look at some of them. The congenital uterine defects, these ones you are born with. And one of them is uterine septum, where you have a cavity that is dividing your uterus here, such that your uterus has no enough space. We also have what we call the presence of separate cavities by conduit here. So we have two cavities here, and of course even here space has been reduced, so there is likelihood of miscarriage. You also have uniconate, where the uterus is very small and only has one functioning fallopian tube. That means even the supply of eggs is minimal, and when it happens, the space is too minimal for implantation or growth of the baby. Others are didelphys. Here you also have a cavity that is dividing and it's quite large, meaning it has also reduced the space. And you also have the formation of an arc. You can see the arc here, and that is a situation called Acute. So these are congenital uterine defects that can lead to a miscarriage. Then we have cervical incompetence. Usually, the normal cervix when you're pregnant should have a mucus plug and it should remain closed. But sometimes some women, either congenitally or have an acquired condition, will have an incompetent cervix that will thin out and dilate, and that will mean that the baby cannot survive within the uteral cavity. We have fibroids, and these ones, like we can see in the diagram, we can see they usually reduce the space within which implantation will occur, and also they will reduce fetal blood supply. So depending on how big or where they are, it will actually affect implantation and fetal blood supply and cause miscarriage. Sometimes you can still give birth to a normal child with them because it depends on size and position. Chronic maternal health factors, we have what we call PCOS, polycystic ovarian syndrome, where we have ovarian cysts, and this one usually causes elevation of androgens, and androgens are male hormones in females, causing irregular periods. We have excessive body and facial hair, acne, pelvic pain, and usually this hormone does not support pregnancy, and therefore you will experience miscarriages and also infertility. We have renal disease, the kidney. If you have a kidney problem, if you have severe high blood pressure, then we also have immunological disorders where your body, the body of the mother, refuses to accept the fetus. It's producing antibodies against the fetus. And also we have diseases we call autoimmune diseases, where the body will raise antibodies. We said antibodies are the body soldiers. It will raise antibodies against its own cells, like lupus anticoagulant and phospholipid antibody. This one usually causes inappropriate blood clotting. So you can imagine if the parent has this autoimmune disease, these antibodies can migrate into the fetus and cause blood clotting, and that would mean the fetus will not survive. We can also have autoimmune against tissues, like in systemic lupus erythematosus, and this one leads to organ failure. And you can see that if your organs are failed, your kidneys, your heart, then you cannot support pregnancy. Acute, these are acute, mild maternal factors, like an active infection. If it goes untreated, like if you're not treating HIV properly, influenza, vaginal and bacterial infections of the urinary tract, then that can cause a miscarriage. We also have endocrine or hormonal factors that can cause, if they are not well controlled, like uncontrolled diabetes, uncontrolled hypothyroidism, that is low thyroid hormone, or hyperthyroidism, excessive thyroid hormone. We also have what we call luteal deficiency. Progesterone is the pregnancy hormone, very important. So if it is being produced minimally by the corpus luteum, then it means that the endometrium is not prepared for implantation. Exogenous factors, most of these are lifestyle factors. Excessive caffeine, alcohol, smoking, drug abuse, and also now some medications, like when you have ionizing radiation in radiotherapy, medications such as chemotherapy in situations of cancer. And usually most of the time, if you're pregnant, you cannot undergo the radiotherapy and chemotherapy. And sometimes if the treatment must be done, then termination of pregnancy must be carried out to prevent any abnormalities in the child. Other medications like NSAIDs, like Brufen, are also not very good when it comes to pregnancy. We have other independent risk factors: advanced age, maternal age over 35 and paternal age over 45. Then we have extremes of age. If you are too young or too old, then there is likelihood that your fetus has some abnormalities that will cause a miscarriage. Excessive stressful conditions, and that is just sometimes if you're working on a very stressful job, or there are some factors that are causing stress, they can cause a miscarriage. Then previous history of miscarriages also causes miscarriage, a likelihood of another miscarriage. And when you have multiple pregnancies also, you need to be checked well to avoid even space limitations of your fetuses. Coming up in our next series, we'll be talking about the biology of a stillbirth. Stay tuned.